In this episode, we're going to be talking about your first visit to the dentist, okay? There's a lot of people that they haven't been into the dentist in years, 5, 10, 15 years. So when you come to an office as a new patient, that first visit is going to entail taking some x-rays, what we call a full mouth x-rays. That's an x-ray of every single tooth you have in your mouth or the bony part of your mouth, okay? And that is a very important part of the exam because that's what it will give us an idea of the status and the health of your teeth, okay? We can see x-rays in between the teeth, cavities in between your teeth, and any abscess that is inside the bone. We can also look at those, okay? So it's very important that you are prepared for that. It takes about 10, 15 minutes for that, and the whole appointment the initial appointment will take about an hour. There is a part that the hygienist is going to come and take some measurements of your gums, which is also important because that will give us an idea of the status of your gums. It will let us know if you have any bone loss or any attachment loss. And the attachment is the part of the soft tissue or the gums that attach to the actual tooth, okay? So when the gums are diseased or you have infection of your gums, that attachment and the bone is lost, okay, which is known as periodontal disease. So when you come to that first visit, you could be categorized in one of the three areas. Healthy gums, which means that you will need only a cleaning in addition to any other treatment that you may require. You may have gingivitis, which is an inflammation of the gums. It's not an infection, but if you try to floss or when you brush your teeth, you'll see bleeding. And up to that point, there is no bone or attachment loss. But as soon as a person starts experiencing attachment loss or bone loss, it is called periodontal disease, which is an infection of your gums. And that is caused by bacterial accumulation inside the gums, which in turn turns into bone loss. As soon as you experience bone loss, that's what's called periodontal disease. And obviously, the treatment for that is more than just a cleaning. And a lot of people get confused for financial reasons also, because obviously when you are treating periodontal disease, the cost for that treatment is more expensive than the cost for just a regular cleaning. So it's very important that you are aware of that, okay? If you are diagnosed with periodontal disease or infection of your gums, you're going to have to be treated more in depth. You may need antibiotics inside your gums. You're going to need what